Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star?
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. You're lucky to see me today, and I'm glad to be here after almost being consumed by a fire in southern Colorado. I was minding my own business, fishing for trout with a couple other guys, and all of a sudden the skies became dark and became a little hard to breathe. And we'd all been hearing about how the sub-Saharan dust was being blown across the ocean to the States. And then that dust was starting to precipitate down to the ground, which was causing some breathing problems. We'd been living with that for a couple of days in the fishing cabin we were staying at. But this particular day, it took a new turn because we were starting to have trouble looking across the valley we were fishing in, which, by the way, was the headwaters of the Rio Grande. So the border between the United States and Mexico, the border between Texas and Mexico in southern Colorado is where we were fishing. And so we were on the Rio Grande, and all of a sudden one morning we noticed we can't really see the other side of the Rio Grande Valley. So somebody got the idea that maybe we ought to turn the radio on. And we did that and started to hear about a new wildfire that had occurred in the area. And as many people probably know, the southern part of Colorado is being consumed by a number of fires. And in the 3 days we were there, I think 9 new fires started from either lightning or just high wind. But that fire was then moving into our valley. It just so happened that this is coming up on July 3rd, so we were going to leave anyway. And we started packing up and walking out of the valley, and all of a sudden gained radio reception and our phone started blasting. And we were told that the state had ordered a mandatory evacuation of regions that were near us, not our particular area yet, but regions we were near us. So we started packing up, we started leaving, and then going up towards Colorado City, began to realize the smoke was coming in fairly thick and it was beginning to get hard to see the highway in front of us. And by this time, we are now on the eastern border of Colorado City, trying to approach Interstate 25, and started seeing all the emergency vehicles, emergency responders, and realized we really were in a fire. So at that point, we were again being given additional texts of a mandatory evacuation, and the decision was either to stop and go south or try to push through the advancing fire line, hoping that we could beat the fire before it came to Interstate 25. And it may not have been wisdom, but it was collective wisdom, and we decided to go straight for it. It kind of reminded me of a time 20 years before this when I had the whole family loaded up in the Ford Excursion, and we were in remote Alaska, and my in-laws were in the forestry as well as oil business. So we took many trips into Alaska and remote regions. And this one particular time, there really was a big forest fire going on to the point where you could see the flames jumping between the trees. And we had no option but to drive through it. And of course, there wasn't at that time or that location the mandatory evacuations or the Forest Service to guide us through it. It was just we were on our own, and we went through it, and we put handkerchiefs on our face, and we just kept driving, and fortunately outran the fire. But unfortunately, sometimes people don't. But anyway, that was Alaska. This was not quite as dramatic, but as we were talking about pain today, many patients describe how the pain in the back of their neck or shoulder or lower back, hip, or SI joint feels like fire. And that's because nerves are being pinched, and nerves make the skin hypersensitive. So sometimes just brushing the skin, people really hurt. And others are saying, how can that hurt just to touch your skin? And the answer is because you've had a pinched nerve for so long that sometimes clothing starts to hurt on the skin, or brushing up against hurts. I've even had patients tell me they can't stand the ceiling fan blowing down on their skin because it takes that nerve that's really excited and makes it hurt. So that's why I think patients sometimes describe fire in the back of their neck or in their lower back into their hip or SI joint. Sometimes that fire goes all the way down the leg and calf and foot. So I started thinking about this, preparing for today's show. Probably 3 people I saw today are people who've had pain for 3 to 5 years. They've seen their general medical doctor and haven't really been able to get a diagnosis. And the whole purpose of trying to find a diagnosis is to establish a treatment plan. How are we going to take care of this problem? And obviously there's a million different treatment plans, but if you don't have the right diagnosis, you don't go down the right treatment plan. So these people have really literally been in the smoke for the last 3 to 4 years. They haven't quite know where to go. They've seen well-meaning doctors, but they weren't specialists, and their problem was not just standard. It was kind of a complicated problem. And so I've had people today come in with what they thought were back problems, but I would say reality, you need a hip replacement. Or I've had people come in who thought it was their shoulder, but no, it's really coming out of your neck. Or had somebody else thinking, oh, this really is my back. And I say, no, it's your sacroiliac joint, which is related to the back. It's right next to the back. It works with the back, but the thing that's barking, making the most noise, where all the flames are right now, is actually the sacroiliac joint. So it really kind of reminded me of what I went through in Colorado. So like us navigating through this forest fire, you use the best information available at a time. You also use all your senses, your hearing, your smelling, your eyes, temperature and whatnot, to try to determine what tissues are being affected and what hurts. And from there, we make a treatment plan. And often the treatment plan is adjusting what the person's doing, using anti-inflammatory, which in layman's terms are like throwing water on the fire to reduce the inflammation, reduce the hotness, reduce the redness and soreness, and then try to put back into place bones, vertebra that are out of place. And they're out of place because something is wrong with the ligaments, that is the tough tissues that keep the bones from shifting around. Try to adjust those ligaments around the spine or around the hip or around the SI joint so that the nerves that go with it, the yellow in these models, so these nerves are not pinched because of misalignment. So a lot of what we do, again, is realigning either through exercise or adjustments. And in the state of Texas, adjustments can be done by both physical therapists and chiropractors, although it varies state to state. So I always use a physical therapist or a chiropractor that can do both exercise and adjustments, because I think the two of those go together. So we use anti-inflammatories as well as simple ice to reduce the inflammation, and then use manual techniques, as we call them, either by physical therapy or chiropractor, to realign the hips, realign the neck, realign the shoulder, and then various exercises to hold those into place. And as I tell patients, look, you've either got to develop the muscle strength, develop the ligament strength, so muscles, or I've got to put metal. So it's either muscles or it's metal. And that metal would push the vertebra back into alignment and hold them there, just like dentists use bridges and use metal in the mouth to hold the teeth straight. I'm trying to hold the vertebra or the SI joints straight so the nerves aren't pinched and they don't have the fire, and you're not living in the fog of smoke, not sure where to go, what direction to be in. I hope this has been useful for you. And if it has, please like me, please subscribe, and please share it. You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star? 'cause I can play the part